Each year, millions of people, men and women, adolescents and adults, are diagnosed with schizophrenia. Schizophrenia can destroy not only the lives of the individuals diagnosed with it, but it can also greatly impact the lives of the individuals surrounding friends and family. The two popular sides of the argument on how to treat schizophrenia regard nature and nurture. The debate of nature versus nurture argues if psychological developments are due to genetic and internal forces, nature, or environmental and external forces, nurture. Although often viewed as a dichotomy in the healthcare system, I ask that doctors bring the two forms of intervention together to more effectively treat schizophrenia. Often within the realm of schizophrenia, health professionals such as psychiatrists and neurologists treat patients with strictly nature-based interventions such as antipsychotic medications to counter the chemical imbalances in the patient's brain. However, strong research serves to counter the idea that schizophrenia can only be cured through nature-based interventions. Studies have shown that by including behavioral therapy in the treatment, over time, schizophrenic patients show improved psychosocial functioning as well as decreased symptoms of schizophrenia, resulting in an overall greater quality of life for the patients. By using both nature and nurture-based treatments instead of only nature ones, doctors can more holistically and effectively treat schizophrenics. To understand why nature and nurture treatments should be utilized together, doctors must first consider both biological and environmental causes of schizophrenia. In a neurophysiological aspect, those with schizophrenia tend to have an imbalance of dopamine and glutamate neurotransmitters along with larger ventricles in the brain. Schizophrenics also tend to have less gray matter in the brain than the average person. Genetics also play a significant role in the disorder. Schizophrenia only occurs in 1% of the general population, but occurs in 10% of individuals who have an immediate family member with the disorder, suggesting horizontal gene transfer. Furthermore, if an identical twin has schizophrenia, the other twin has a 40 to 65% chance of developing the disorder as well. However, some scientists, as well as the National Institute of Mental Health, believe that genes are not the only cause of schizophrenia. Environmental factors also play a role in the development of schizophrenia within an individual. Through research, several environmental factors have been identified as potential contributors to the onset of schizophrenia. The National Institute of Mental Health states that exposure to specific viruses, malnutrition before birth, birth complications, and several psychosocial factors can contribute to schizophrenia. The experiences that an individual has during his or her life can also affect their susceptibility to schizophrenia. In one study, researchers examined the relationship between heritability and environmental factors by studying two brothers with schizophrenia. Keeping heredity in mind while studying the two brothers, Dr. Keltner and his team of researchers explored the past of the brothers in search of environmental cues that could have been involved in the onset of the disorder. The researchers found that both of the brothers had previously experienced physical and emotional abuse by their family members through molestation, punishment, beatings, and abandonment. The study concluded that individual environmental stressors, paired with repeated experiences of abuse, can influence the onset of schizophrenia. If schizophrenia is a byproduct of both nature and nurture, the question to be asked is, why is the current healthcare system placing such a preference on nature-based interventions, primarily pharmaceutical drugs, and overlooking nurture-based ones? Unfortunately, overprescribing and inappropriate prescribing of medications have a notorious presence in today's healthcare system. Specifically, more doctors tend to jump straight to prescribing a patient drugs when drugs may not be needed to treat the patient. Furthermore, according to a study conducted by the Centers for Disease Control and Prevention, many Americans will visit their health specialists with a mental health-related issue and will leave with a prescription for drugs, such as antipsychotics, and no knowledge of alternative treatments. An alternative treatment could include cognitive behavioral therapy, which might actually be more effective in treating that particular patient's schizophrenia. From 1995 to 2008, antipsychotic prescriptions almost tripled in the United States to more than 16 million prescriptions. A possible reason for the rise in drug prescriptions could be attributed to healthcare professionals' monetary incentive for prescribing drugs. For example, a psychiatrist may be motivated to prescribe a popular antipsychotic to a schizophrenic patient due to the additional payment the doctor may receive from pharmaceutical corporations that want to sell their drugs. Several studies have been conducted to examine the power of nurture treatments for schizophrenia. Most of these results have found the efficacy of using only antipsychotic drugs to treat schizophrenia is very limited. In one study, researchers employed a randomized controlled trial for a sample of 1,268 patients with early-stage schizophrenia in an effort to examine the effectiveness of antipsychotic medication alone versus antipsychotic medication paired with psychosocial therapy. The study used an independent group's design in which some of the participants were assigned to the antipsychotic medication-only group, while the others were assigned to a group which used the medication as well as psychosocial intervention. The psychosocial intervention included psychoeducation, family intervention, skills training, and cognitive behavioral therapy. The results showed that the group that used nature and nurture-based interventions had a lower rate of treatment discontinuation, lower risk of relapse, improved social functioning, and an overall higher quality of life. The statistical significance of the study proved that the results were not a fluke. The rates of treatment discontinuation were 14% higher in the drug-only group. The p-values for relapse, social functioning, and quality of life were all less than or equal to 0.02. P-values less than or equal to 0.05 indicate statistical significance. This study alone demonstrates how pairing nature treatments with nurture ones can considerably progress and improve the lives of patients with schizophrenia. Another study focused on the effects of cognitive therapy paired with antipsychotic treatments. The researchers used 60 cognitively impaired schizophrenic patients and implemented a single-blind randomized design. Half of the participants were assigned to the standard treatment group, which only used antipsychotic drugs, while the other half were assigned to the cognitive treatment group, which used the same antipsychotic drugs, but paired with cognitive therapy. After an 18-month time period, the participants in both groups were assessed using the Global Assessment Scale, the scale for the assessment of negative symptoms, and the scale for the assessment of positive symptoms. The results showed that the patients in the cognitive therapy group had a significantly higher improvement in global functioning than those in the standard treatment group. The p-values for all the conditions were measured less than 0.05. The specific conditions that improved included psychosocial functioning, motivation, hallucinations, delusions, and disorganization. The popular psychosocial interventions for schizophrenia each provide unique benefit to individuals. Cognitive behavioral therapy is considered the most popular form of psychosocial treatment for schizophrenia. CBT has been proven to improve both negative and positive symptoms of schizophrenia, as well as the severity of the symptoms. CBT is also effective in reducing depression and increasing social functioning among schizophrenics. Cognitive behavioral therapy has also been found to be more effective in early onset schizophrenia, so it should be administered in the early progression of the disorder. Social skills training is a form of intervention that serves to solely improve a patient's social functioning skills. Schizophrenics tend to have antisocial tendencies, so social skills training focuses on improving interpersonal skills. Psychoeducational family intervention has been associated with reducing psychiatric relapse and improving familial relationships. A significant question to consider is how can a schizophrenic be prescribed nurture treatments just as they would drugs? And the answer lies in the hands of the healthcare professionals. As mentioned earlier, many patients are not even made aware of alternative nurture-oriented treatments by doctors when discussing medication. The first step that should be taken by doctors is to educate schizophrenic patients of the numerous alternative treatments that exist and have proved effective. Next, if a patient chooses to comply, the doctor should begin an analysis to determine which behavioral treatment would be best for the patient. Then, the doctor should discuss with the patient a plan or program for beginning the nurture treatments if they are medically credentialed to do so, or recommend psychiatrists, neurologists, or psychologists who specialize in behavioral treatment. Lastly, doctors should monitor the progress of patients undergoing behavioral treatments just as they would monitor the efficacy of specific drugs prescribed to patients. In conclusion, the issue of doctors prescribing schizophrenic patients antipsychotics without any alternative forms of psychosocial treatment is one that must be addressed and solved within the healthcare system. Currently, there's a widespread concern involving inappropriate prescription in healthcare and very little utilization of nurture-based interventions. Specifically in schizophrenia, the benefits and advantages of pairing nurture-based interventions with nature ones are too substantial to ignore. Doctors must avoid the mindset that the most they can do is prescribe a schizophrenic patient a common antipsychotic and realize that there is an additional step to be taken, outside of the standard medication, to fully ensure the patient has the highest chance of improvement and recovery. Doctors need to make an active effort to destroy the barrier between nature and nurture regarding schizophrenic treatment because it is a barrier that stands between patients and healing.